The White House has delayed the Obamacare employer mandate, not the individual mandate. So initially, the Obama administration, as part of the Affordable Care Act, was going to fine companies, employers, who didn't provide health insurance in 2014, assuming they met those minimum requirements, right? 50 full-time workers, and there may be something else. But the main thing is if you have 50 full-time workers in 2014, you have to provide, or at least offer to provide, insurance, health insurance to your employees. That's going to be delayed. The Obama administration has said they're going to delay enforcing that until 2015. And they said that they've just heard so many, what they're characterizing as significant concerns from employers about how challenging it will be to implement it, that they've decided to wait on that. Some are saying, hold on a second, where does it say that the Constitution gives President Obama the authority to change the implementation date of a law that has been passed by Congress? I think that that may not really be the right question, because there's a difference between changing the implementation date and changing the enforcement date. And as we know, surrounding issues of marijuana and conflicts between federal and state legislation on marijuana decriminalization and legalization, President Obama can choose not to enforce certain laws without just by his signature, by his directive, changing that law. And I think a lot of people, when they're making this constitutional argument, Natan, are completely missing that.
Yeah, I think they're really scrapping at the weeds there for some better argument. I mean, the reality is that if there's anything wrong with this, I think it's that the Obama administration bowed down to pressure from business groups, and they're not postponing the individual mandate, which means that people who may get covered by their employer starting in 2015, because the individual mandate goes into effect in 2014,
right,
they're going to have to buy one that they otherwise would get for free.
Well, the law does not require that the employer provide 100% of the insurance for free.
No, I'm saying that there's probably thousands of cases where that would be the case. There's going to be people who have to buy their own insurance.
Sure.
They make more than the federal cutoff for a subsidy, and in 2015, their employer will cover, half to all of it.
The other thing, Lewis, which is interesting, is that delaying the employer mandate is going to deprive the federal government of a year of those penalties, right? Presumably there would be some employers who, even if it was to be enforced starting in 2014, would not meet the requirements of that employer mandate and therefore would have to pay a fine. So then the question from some devil's advocates is, hold on a second, certainly the government calculated how much money are they likely to receive from collecting those fines from non-compliant employers. They're not going to have that money. And what's the effect going to be of that? What's the effect going to be on the budget neutrality of Obamacare? At the same time, Republicans have been predicting a downturn in hiring, right? They said, hold on a second, as soon as this starts to be enforced, employers aren't going to hire because they're not going to want to go over that 50 employee limit, or they just are going to want to reduce the number of people they have to provide insurance to. The two might cancel out. I mean, we just don't know right now what the economic effect of that is going to be over this 1 year period.
Yeah, I find this whole thing very strange. I mean, these are concerns that the Obama administration heard before Obamacare was even enacted.
Mm-hmm.
I really hope that this isn't another just corporate pandering move by Obama.
That's really the question. And certainly Obamacare as an institution will put in millions of new customers into the for-profit healthcare system. And that in and of itself is certainly no small thing for for-profit insurers.
Not at all.
We're going to keep covering it. We'll follow up as we close in on 2014. Of course, we'll tell you which aspects of Obamacare, and it's a lot of them, it is certainly most of them, will become active. And if some of them won't be enforced, we'll tell you that as well.